First tonight, we are taking a closer look at the issue of bias in healthcare for LGBTQ plus patients. June is Pride Month, and one local doctor is making it his mission to ensure that members of that community receive the best quality care when interacting with the healthcare system. As Stephanie Wade learned, that's not always the case.
Pride Month is really a celebration and allowing of people to just be themselves. And sometimes, as this doctor tells me, members of the LGBTQ plus community don't always feel comfortable being themselves or are as accepted when speaking with healthcare professionals.
So I've actually experienced it firsthand.
A family medicine physician at Community Health Network, Dr. Michael Giffen, says he's felt the discomfort from healthcare professionals after telling them he's gay.
I've had appointments that were kind of cut short and kind of changed because of it, that you can tell the doctor got awkward and anxious and kind of was cutting corners to get out of the room.
And that treatment, he says, can have lasting effects.
It feels terrible, honestly, and you kind of know that you're not getting the right care and the best care you deserve. Causing some people to just not come back or seek medical attention. If a patient comes in and you're not getting a good sexual history and you don't know risk factors, you don't do the right STD screenings or the right testing, then that has ramifications on just public health in general. And that's why we have really bad rates of syphilis and gonorrhea and chlamydia in the community, because we really aren't asking the right questions. We aren't really getting the correct history from patients to treat them the right way.
It's an experience Emma Vosky is all too familiar with as well.
You literally might refrain from the medical care you need because you're not certain what's going to happen when you walk in the door.
Also a member of the LGBTQ plus community, she says it's even more challenging for people who are transgender.
People have held off on going to see oncologists when they need to see an oncologist because they're not going to be able to find somebody who is affirming.
She says she's encountered large healthcare systems that don't have any endocrinologists who work with non-binary or transgender people.
Some of the most basic gender health-related care that trans non-binary people need, it is so difficult to find. It's almost always a word of mouth.
Calling on medical professionals to not only be supportive of the community.
My ultimate goal is just having all providers be more open, accepting,
but also competent in treating them.
Set aside their philosophies and their assumptions and maybe even their biases and prejudices and see and treat the person in front of them as a whole human being.
Stephanie Wade, WRTV.
The advocates that we spoke with suggest hospitals create forums that are welcoming to people of all backgrounds, train their staff yearly, and add signage that indicates the medical facility is accepting of people who are LGBTQ+. Healthcare systems around central Indiana, we found out, are taking steps to better communicate and provide better care to people of different backgrounds. Community Health, Indiana University Health, and Ascension St. Vincent all offer training to educate staff on gender identity